Good afternoon. Thanks for joining this month's October Town Hall. I'm joined today by Katie Mathers, who's been here before. You know her well, our Director of Risk Management, who will walk through a little bit of issues related to the health officer orders, and also by Dr. Rami Eskander, who's the Chief Medical Information Officer at Harbor UCLA, and he's going to share some exciting progress that has been made by the system in terms of virtual healthcare. So really excited to hear about that. Before I turn it over to Katie, I want to extend my congratulations and thanks for reaching the milestone of 89% of DHS workforce who have been fully vaccinated, and 91% of DHS workforce have received at least one vaccine, COVID vaccine, and then is well on their way to getting to full vaccination. Thank you to those of you who have taken the step of getting vaccinated. It is the single best thing that we can do to safeguard the health of our patients, of our staff and one another when we interact with people at work, and of our community. And it's so important for helping us to bring this pandemic to a close and getting the virus under control. So for those of you who have gotten the vaccine, huge thank you. We have a small number of staff who have not yet been fully vaccinated. Some number of those individuals, some of you who may be listening, we've received your requests for either a medical or religious exemption from some of you. Thank you for submitting those, and the county will be working through those over the next couple of weeks and couple of months, and we'll be getting back to you with additional information about that exemption process. Please remember, if you're still thinking about the decision to get vaccinated, about the safety and the efficacy of the vaccine. There have been millions of people who have received the vaccine in the United States and across the world, and it's been shown through robust data to be safe and efficacious. It reduces the risk of serious infection and death. It reduces the risk that you will get infected and that you will transmit the virus to others. And because of that, that's what's needed to help curb this pandemic, along with a combination of other public health interventions. And it is safe. The risk of complications and serious complications from the vaccine is incredibly small. As always, if you have questions about the vaccine, we encourage you to seek out fact-based information from reputable sources to get your questions answered. Feel free to go to Employee Health Services, reach out to Dr. Balearis, our COVID medical director, reach out to me, reach out to any one of a number of people across the facilities, and we'll be happy to provide you with information or resources to address whatever questions you have. As you know, the health officer orders from the state and the county are in effect, and we are required to have all staff who are providing patient care or working in patient care areas to be fully vaccinated. Again, thank you to those of you who are serving on the front lines, caring for our patients. You provide that extra level of safety that our patients expect and that they deserve when they come in for care. Because of the health officer order, we have had to make some reassignments of some staff who are not yet fully vaccinated. Those are temporary reassignments, and we appreciate the flexibility of everyone who's been involved in this process. From the units where there's been staffing movements, to the staff themselves that have had a temporary reassignment, to the units where those staff have potentially been moved to and they're adjusting to new duties and getting used to their new assignments in their new location. I know it's an adjustment for everybody. We appreciate the flexibility and positive attitudes that everyone has demonstrated over the last couple of weeks as this has gone into effect. Please know that we're also doing everything that we can to mitigate any impact that there might be from these reassignments on the services that we provide to our patients. Throughout everything, first and foremost, front of mind for all of us is the care for our patients. And we have taken a number of steps to minimize the impact of these reassignments on the frontline services we provide. We are onboarding additional registry and contract workers wherever possible. We're hiring additional county workforce members wherever possible. We have out-of-network contracts in place to be able to offer our patients other locations in which they can receive certain services wherever that's possible. We're looking to discharge patients to lower levels of care, and thanks to our Housing for Health team members who are assisting with that. Thanks to our colleagues in the EMS agency who are working with our colleagues on different diversion protocols and on flexibility of some of those processes that go through in the emergency departments and on the pre-hospital care protocols. Um, we are also really appreciative of those individuals who are fully vaccinated, who have voluntarily taken on assignments in patient care areas. Maybe they have that experience, but they most recently haven't worked in a patient care area, and they have volunteered to go back into that setting in the short term. We will do everything we can to minimize the reassignments that are needed from individuals who are vaccinated into patient care areas. I think that the steps that I just outlined, among others, are going to be able to address the largest amounts of the shortages that we face in those facilities. And I don't anticipate that we will need large-scale reassignments on the level of what we had during the COVID surge in the winter. That said, we may, in specific units or specific facilities, be in need in terms of providing a high level of care and safety for our patients, may need to use certain reassignments, and we will maintain in constant communication and contact with you wherever we anticipate that to be the case. With that, I am going to turn it over to Katie to walk through some other issues related to the health officer order.
Good afternoon. As Dr. Gali mentioned, I will be providing you with some additional information on the California Health Officer orders and the expected practices and policies that have come into place to ensure compliance. First, it is important to underscore, as Dr. Gali mentioned, that at DHS, we have very much to be proud of. The overwhelming majority of our employees have already provided proof of full vaccination. And in just the last couple of weeks, dozens more have provided proof of their first dose in a 2-dose series. Today, over 90%, in fact, it sounds like it's 91% as of right now, of our employees have at least one dose of the COVID-19 vaccine. Overall, we are in a very good place and we are steadily moving in the right direction. So once again, thank you to each and every one of you who have taken the steps necessary to be in full compliance. We appreciate you doing what is right and what is needed so we can protect each other and continue to meet the needs of the patients and the communities we serve. The information I will now share will primarily apply to that small percentage of our workforce who have not yet provided proof of vaccination, including those who have applied for an exemption from the vaccine mandate. I'm going to start by addressing those who have applied for an exemption from the vaccine mandate. But as a reminder, in order to comply with the California Department of Public Health orders dated July 26th, August 5th, and August 19th, as well as the Los Angeles County Health Officer order dated August 12th, all DHS workforce members must be fully vaccinated against COVID-19. And this also includes the county policy, and must provide proof of full vaccination against COVID-19 unless they have been granted an exemption. DHS employees may request an exemption from the county's policy and the CDPH order on the following grounds: a medical condition or disability that does not allow them to get vaccinated against COVID-19, or a sincerely held religious belief, practice, or observance that prohibits the employee from receiving a COVID-19 vaccine. But please note, this does not include social, political, or economic philosophies or personal preferences. Those are not sufficient to justify an exemption. More information on the exemption forms can be found on our COVID-19 SharePoint, and those who have already submitted an exemption form for consideration, you should have received a confirmation that their form was received. DHS will be working with LA County leadership to appropriately review all requests for vaccine exemptions, but as Dr. Gali mentioned, that's going to take some time. Finally, and this is very important, for those who applied for an exemption, while you are waiting for a response to your application, you are responsible for complying with the weekly COVID-19 testing. I'll go into more details about testing compliance shortly. Next, I want to review some key points in our recently finalized DHS expected practice on the vaccine mandate. No DHS workforce member for whom vaccination status is undocumented, whether you're an employee or a non-county workforce, will be permitted to work in a building or area of a licensed health facility where patients may be present. That would include hospitals, clinics, pharmacies, registration, and the list goes on. Additionally, in accordance with the August 19 order, workforce members without a vaccine status in the correctional setting will not be permitted to perform patient care duties in non-licensed areas. To this end, temporary reassignments have already begun to take place across DHS. If you have received a notice for temporary reassignment, please ensure that you are reporting at your new designated location on the date noted. If a workforce member has in good faith obtained a first dose of a 2-dose vaccine series, or you received the J&J vaccine, you will be permitted to remain or return to your customary work assignment, pending completion of the vaccine series, as long as you do it in the time frame set forth by the CDC and FDA. It's important to underscore that workforce members who have not yet provided proof of vaccination and are currently assigned to work in a hospital campus, even if that's just a periodic visit, you may not enter patient care buildings when patients are present. For example, workforce members cannot go to a cafeteria inside a hospital. Workforce members on a non-hospital campus where patients may be present, such as a clinic or a pharmacy, may work in an isolated area with no patient contact at any time, including during breaks and when entering and exiting the building. For the temporary reassignment from your usual work locations, DHS employees who have not reported their vaccination information or who are seeking an exemption from vaccination will be temporarily reassigned from their usual work location, and many have already received those reassignments. The new work location may be within your current assignment site, or it may be at another DHS or county site as dictated by business needs. Finally, as part of our compliance with this new normal, all DHS workforce members and rehires commencing county service after the effective date of the county policy must be fully vaccinated against COVID-19 and must provide proof of vaccination against COVID-19 before their start date, or request an exemption as outlined in the county policy during the onboarding process. Now, I'd like to share some key information about some notices that are going to be going out in the near future. The first notice that you might be hearing about is the notice of testing requirement. All DHS workforce members, All DHS workforce members who have not provided proof of full vaccination are required to sign up in the Fulgent system for testing if they have not done so already. And they must take their first COVID-19 test immediately. And these tests are done at the Fulgent sites that are identified on the website. This testing requirement applies to all DHS workforce members who have received no doses of a COVID-19 vaccine, are semi-vaccinated, or have received all recommended doses of the COVID-19 vaccine but have not submitted their proof of vaccination. Workforce members who meet any of the above criteria are required to test, even if they have requested or received an exemption from the policy's vaccination requirement. I'd like to underscore that the testing requirement includes employees in non-clinical settings. For example, workforce members at HSA or those that are exclusively teleworking still must be compliant with the testing requirement. Workforce members who are on a long-term leave will not need to test while they're on that leave, but they will need to come into compliance with the testing requirement as soon as they return to work. An official notice of testing requirement will be sent to those workforce members who are not meeting this criteria. The notice will inform the employee that if they fail to satisfy the policy's regular testing requirements, the department may initiate disciplinary action for noncompliance. What does that mean? That means failure of the employee to comply with the requirements outlined in the notice of testing requirement will result in the employee being served with a 5-day suspension. Non-compliance with the testing requirement after 10 calendar days following the return from the 5-day suspension will result in the employee being served with a notice of intent to discharge. Failing to achieve compliance within the designated time period will result in an employee's discharge from county service. For further details on the notice of testing requirement and corrective action plans, please continue to look out for your email, and that information will come to you. Another notice that is forthcoming is the notice of vaccination requirement. The notice of vaccination requirement will be sent to all workforce members who have not provided proof of vaccination. The notice of vaccination requirement will instruct the employees who are non-compliant with the full vaccination requirement to submit proof of receipt of all doses of a COVID-19 vaccine within 45 days, and that's calendar days, from the date of the notice of vaccination requirements that is sent to the employee. Failure of the employee to comply with the requirements outlined in the notice of vaccination requirement Failure to follow that timeline and the decision that comes from the denial of an exemption, for example, or the timeline set in the decision denying a request for reconsideration will result in the employee being served with a 5-day suspension. Noncompliance after 30 days following the employee's return from the 5-day suspension will result in the employee being served with a notice of intent to discharge. And again, here it's important to note that failure to comply with this policy will result in an employee's discharge from county service. There's good news. If you still need the COVID-19 vaccine, you can get that vaccine fairly easily. You can go to your own provider. You can go to any of the community vaccine testing sites, or you can come here at DHS. The COVID-19 vaccine continues to be easily accessible to all DHS workforce members. You can visit the COVID-19 SharePoint to submit a vaccine request via Persenda. We are offering the Pfizer vaccine to all workforce members, and you can schedule an appointment at the facility of your choice and get the vaccine during your working hours. As a reminder, if you receive your vaccine outside of DHS, proof of vaccination should be submitted as soon as possible to Employee Health Services. Proof of vaccination should be submitted by email. If you visit the COVID-19 SharePoint, you'll find a full listing of all Employee Health Services across our DHS facilities. Again, further details on the notice of vaccination requirement and the corrective action plan will be sent by email. Just be on the lookout. Finally, before concluding, I want to acknowledge the fact that these last 18 months, more than 18 months, have been very challenging for everyone at DHS. However, it is important to remember that our perseverance and our commitment to follow the science is paying off. Thanks to the growing number of LA County residents now vaccinated, we are seeing lower rates of hospitalizations due to COVID, and we are well on our path to a new and better normal, and that is something to be very proud of. I thank you in advance for your patience and cooperation as we move forward with the vaccine and testing requirements, and please continue to stay informed and engaged with all of our health officer order notices. Thank you.
Thanks, Katie. Thanks for going through all of that information. I know it's a lot. Notices, as Katie mentioned, will be sent out to the relevant staff. Please read those carefully. As Katie outlined, the consequences are very serious for failure to come into compliance with the county's policy. And the county's policy is our pathway to compliance with the full health officer orders put forward by the state and the county. So please take those seriously. We want everyone who's a part of the DHS family to remain a part of the DHS family. So please review those notices and take whatever is the most appropriate action given your specific situation. We're going to shift gears a little bit. I'm going to turn it over to Dr. Eskander. I'm very excited to hear him talk a little bit about the rollout of virtual healthcare tools. We try in these town halls not just to give you updates on kind of the latest and most relevant information with respect to COVID, which has been a lot of our focus over the past 18 months, but also more and more to give you a sense of some of the strategic work that's going on in the department, efforts to enhance services, enhance the care we provide to our patients, and the efforts around virtual healthcare are one key part of that. So thank you, Dr. Eskander, for coming to talk with us and for sharing a little bit about virtual healthcare.
Thank you, Dr. Galley. If the past 18 months have taught us anything, it's that we must be innovative if we wish to remain engaged in the healthcare lives of our patients. To that end, and under the leadership of Pam Griffith, our Chief Health Information Officer, DHS is preparing to deploy a suite of virtual healthcare tools aimed at implementing technologies and workflows to enhance DHS's ability to deliver and our patients' ability to receive outpatient healthcare services. We are trying to meet patients where they are. This is not intended to replace in-person care. On the contrary, this is meant to bolster in-person care when it is absolutely critical and necessary. Using patient and provider-friendly tools embedded in ORCID, our EHR makes them broadly accessible across all sites wherever ORCID is accessible. From the outset, patient advocates and workforce experts have been integrally involved in the design and build of these tools. This ensures that the needs of our patients and staff always remain at the forefront. Some might ask, Why virtual healthcare? Why DHS? Why now? There are many answers to that question, but I will focus on two that I believe align with our mission here at DHS. First is our patients are unique. Our patients are uniquely under-resourced, and our patients are vulnerable. They have they have barriers that involve access, meaning our patients have language difficulties, transportation challenges, financial issues, childcare issues, all of which impact our patients' ability to come and see us. It is our duty and obligation to minimize those barriers. Secondly, our mission at DHS has been and will always be patient fairness and equity. To that end, we must offer streamlined and simpler access to healthcare. We must improve patients' ability to receive healthcare services when in-person services are not critical or are not feasible. We've learned that these tools work. When we take a look at our no-show rates for video visits and phone visits, we see that they're lower, letting us know that this is a tool our patients want and this is a tool our patients need. Honestly, we always must ask ourselves, shouldn't our patients have access to the same outpatient healthcare options that other residents enjoy, that you and I enjoy when we decide to engage with our healthcare provider? Again, this is our effort to meet patients where they are, not where we would like them to be. We understand that there are some patients who will be unable to use these tools or uninterested in using these tools. And that's okay, because for those patients, there will always be a DHS provider who is available to see them in person. Now, when we talk about the suite of healthcare tools, the suite of virtual healthcare tools available to us, they are just an element, a tool that we will weave into the fabric of care here at DHS. And the tighter this fabric is, the more likely we are to prevent or catch patients from falling through the cracks. So I just want to take a minute and go over what some of these tools are, and thank some of the people who have been working so diligently on helping deliver them to you and our patients. First, Dr. Anshu Abhat has been working with the DHS branded portal group, establishing a health portal website and a patient portal app that is branded uniquely for DHS. This allows clear navigational tools accessible on the web, allowing patients to access results, be able to message their provider, and request medication refills. Some of you have heard of the My Wellness portal, and that will be transitioning to the LA Health portal as it becomes branded and unique to us. Second is a group that I'm working with helping deploy Orchid integrated video visits, meaning that you don't have to leave Orchid to perform that function. It is available right at your fingertips. This will allow us to be able to do group and individual visits, as well as having simultaneous real-time translation services, something we don't have today. There is also a clinic-based patient messaging tool with bi-directional capability that Marissa Klein is working on. This allows us to be able to communicate with patients large scale in the event of an emergency or using automated messages. Imagine a scenario where there is a disaster on a campus, and with a few short keystrokes, you could come in contact with everybody scheduled that day and let them know to increase travel time or to call and reschedule without having to do that manually for every patient. That's increased efficiency that we can leverage. We also have Dr. Reagan's working on a structured patient messaging encounter, also called an e-visit. This is a new CMS-defined visit type. It will offer earlier and faster care for straightforward medical issues. Dr. Guillermo Diaz is working on optimizing existing workflows and optimizing existing tools like phone visits to see how we can make them easier and more available for patients as well. And lastly, Dr. Faye Christian is working on a true data integrated remote patient monitoring service, allowing us to engage with patients in the background, identifying when needs might be missing and how we can best deliver those needs. So we've talked about the why and we've talked about the what. Let's talk about the how for just a couple of minutes. Beginning November 30th, 38 sites and clinics will be transitioning from Zoom and Mommy to the ORCID integrated video visit tool. They will also be given access, our patients as well, to the new DHS branded portal as well as website. A few weeks later, on January 25th of 2022, the remainder of DHS will be able to use those same tools as well. It is vital that we prepare our workforce for these changes. Education and training are starting in a few short days. Facility adoption champions and leaders have been identified for each site, and they are working diligently with the medical directors and the service line leaders to help identify trainers and super users to help support our frontline staff when we go live. End user training is available for all who want it. Honestly and truthfully, these solutions are easy to learn and easier to navigate, and I'm excited to see them in the hands of our staff and our patients. It is even more important that we prepare our patients because supporting them is critical to our success. It is critical in order for us to meet them where they are. And to that, we have been incredibly thoughtful about how to deploy these tools and how to make them accessible. For example, patients can join video visits directly from the patient portal or via a link sent in email or text. They don't need to download an app to be able to do this. Simply from any web browser, they can visit their doctor or provider. They can also check for device connectivity issues long beforehand, giving them instructions on what to do. And if there are any issues, we direct them to a customer service line helping solve these technical issues. If the patient loses their connection during a video visit, it's as simple as re-clicking the original link, taking them back to their provider who would still be there in the room. And if the patient's device fails or the patient needs more help, again, there's a patient-facing call center to help the patient through these challenges. This is DHS moving forward. This is 21st century healthcare that was brought upon by a crisis. I'd like to thank a few individuals before we move on. I'd like to thank our information technology team, led by Kevin Lynch, for their partnership in this technology-enabled process optimization. This is a model for the new better normal for care here at DHS. Thank you. I'd also like to thank Dr. Galley for inviting me to present on this important work, making sure that it gets out into the hands of our staff and into the hands of our patients. Lastly, but not least, I'd like to thank the DHS workforce for being so truly committed to our patients that they are willing to go through the necessary changes and learn through the difficult times, and opportunities that arise out of that will benefit not only our patients, but our patients to come. As I close, I'd like to share a video message from Dr. Hal Yee, our executive sponsor and the DHS Chief Deputy Director of Clinical Affairs. Dr. Yee has been an instrumental and inspirational leader of this project, and to that, we are grateful. Thank you.
Hi everyone. Over the past decade, the LA County Department of Health Services has built and implemented modern digital platforms, including ORCID, eConsult, and ELM, so that you, our clinical teams, can better care for our patients. I am very excited that we will now be deploying a robust set of virtual healthcare tools to facilitate connectivity and communication between our patients and their healthcare teams. These features include streamlined e-visits, patient messaging, video healthcare visits integrated into ORCID, and the personalization of the LA Health Portal app, formerly known as My Wellness. These tools should improve patient engagement and satisfaction by offering them more options for their care, while also allowing our healthcare teams to provide the right care at the right time in the right place. This training will prepare all of you to optimally use our new virtual healthcare tools so that you and your teams can continue to provide extraordinary care to our patients in an even more effective and efficient manner. I want to personally thank you for everything that you do and have done for our patients, especially during this past very challenging 18 months.
I hope you enjoyed the video. Thank you to Katie and Dr. Eskander for walking through that information. I'm going to close with just a couple of points. First, as much as at least for me, it's hard to believe we're headed toward the winter season, and that is flu season. Please remember to get your flu shot. Flu shots are widely available, certainly from your personal provider if you choose to get one there, but also widely available from within DHS at the Employee Health Services. There's also mobile flu shot carts going around, so you can take advantage of those. And please remember, if you do get your flu shot elsewhere, to send your proof of vaccination in through Employee Health Services. And you're welcome to get the little sticker that goes on your badge so you can be easily identified as someone who has received a flu shot. COVID boosters, those are still available. Right now, as of I think this moment, they're only available for individuals who have received the Pfizer vaccine. Today, at some point today or tomorrow, we anticipate that the CDC will approve boosters also for those individuals who received the Moderna vaccine or the J&J vaccine. So be on the lookout for additional information there. If you are interested in a booster, there's certain populations that are eligible for those per CDC guidelines. That includes people with certain underlying medical conditions and certainly, among other factors, those who work in settings where they're at increased risk of occupational exposure, such as healthcare. You can sign up for a booster on the MyTurn website. And if you go to the DHS COVID SharePoint site and you click on COVID boosters, there's information there about how you sign up and for the access code so that you can get signed up through one of the DHS clinics. Next, our EDIA, Equity, Diversity, Inclusion, and Anti-Racism effort is well underway. 175 of you right now are participating in capacity building sessions across the organization. You're there because you're participating in either one of the affinity groups that's been set up or participating in one of the 8 subcommittees. Thank you for doing that capacity building work and for your contributions on part of those affinity groups and subcommittees. Those groups will get launched and start the work of developing and providing input into a strategic plan that will cut across all of our work in DHS, both internal facing efforts within our DHS workforce about how we can enhance equity, diversity, inclusion, and anti-racism within our own workforce and county family, and also looking outward as we think about the services we provide to our patients. We want to do that with an EDIA lens, and those subcommittees and groups will be weighing in on what strategies and initiatives we need to take on to do better in that regard. We're also going to be setting up, for those of you who are not necessarily on a subcommittee or an affinity group, there's going to be listening sessions that are offered across the system. Information will be forthcoming very soon about where those are located and how you can participate. And those are chances to just share your experience, share what you desire for DHS, share what you hope to see in the department and what your suggestions are for how we get there. And that input will be used by the subcommittees as it works to develop ultimately a strategic plan. Of course, we'll come back and share that strategic plan with you here as we get farther down that path. And last thing, don't forget, it's also open enrollment month. The deadline for the 2022 annual benefits enrollment, as always, is midnight, October 31st, Halloween, so don't lose it in the Halloween festivities. Don't forget to fill out your open enrollment forms. This is your chance to make changes in your coverage and your dependents. Those changes will be effective January 1st, 2022 and last for the full 2022 calendar year. This is your chance to make those changes. If you don't make them now, unless you have a qualifying life event, you won't be able to make the changes until the following year. So please don't forget about that. If you have questions, you can call the benefit hotline. I think that information is listed on your screen. The phone number is 213-388-9982. And if you have information or have questions, just look at those websites, call the benefit hotline, look at the information that was mailed to your place of residence, and don't forget to fill out the paperwork. That's it for us today. Next month, we'll be focused on the DHS strategic plan and sharing with you where, from a big picture view, we are taking the department over the next couple of years and the goals and initiatives that we have underway. So I hope you'll join us next month. And that's it for today. Take care.